Hi, welcome back. I'm so excited to see that you're interested in our study. I'm going to tell you a little bit about the details of the study so you can be well informed before starting. What we'll do is I'll take you through all of the information that's provided in our consent study form, and then you'll answer a couple of multiple choice questions at the end, making sure that you understood everything I was talking about. The first thing that you should know is that the title of our project is called Families Moving Forward, or FMF Connect Pro. This study is being conducted by the University of Rochester with principal investigators of Christy Petrenko and Cristiano Taparello from Psychology and Computer Engineering. Is to test a new program to increase access to care for kids with fetal alcohol spectrum disorder, or FASD, and their families. In the study, mental health providers will learn how to do routine screening of prenatal alcohol exposure, diagnose FASD, and support families using the Families Moving Forward Connect app. The study compares two different methods of training for mental health providers on how to provide this FASD-informed care. What's involved in the study? The first thing you'll do is an eligibility screening. This is coming right after this video with a couple short surveys online. They'll check to make sure that you meet study criteria and gather demographic information. This should take about 5 to 10 minutes. The next part includes some surveys. The first of the surveys, which is before we start the training methods, asks about your knowledge and confidence in providing FASD-informed care, information about your clinical practice, as well as barriers and facilitators to providing FASD-informed care. It should take about 20 to 30 minutes online. Then you'll be randomly selected to participate in one of 3 possible training methods. Of these 3 groups, the first is a live ECHO session. ECHO stands for Extension of Community Healthcare Outcomes, and it's a telementoring program that includes community providers and subject matter experts. It's provided over 13 one-hour sessions, delivered about every other week on Zoom for 6 months. In each of these meetings, there will be a brief didactic or lesson and some case-based learning. You'll get access to the FMF Connect Pro dashboard with additional resources and client progress monitoring tools to support families using the app. The second group is a self-directed format. In this group, training is provided asynchronously online through the FMF Connect Pro dashboard. That means that it's self-guided and self-directed. You can do it at your own pace. There are 13 learning sections. You'll have access to videos, brief activities, and other materials to learn how to do FASD-informed care. You'll also get access to the FMF Connect Pro dashboard with additional resources and client progress monitoring tools to support the families using the app. You'll also be asked to do a brief evaluation at the end of each section. The last group is the waitlist group. The waitlist group helps us to see what providers learn when they don't receive the program right away. If you're in this group, you'll receive everything in the self-directed format that I just described after completing the surveys of 6 months. For all 3 groups, there are free continuing education units for the fields of social work, mental health counseling, or psychology. The number of CEU credits that you'll earn depend on how much of the program that you complete. In order for you to receive those credits, your name, email address, credential, and profession information will be sent to your accrediting body. Regardless of which group you're in, you'll be in that program for about 6 months. At the end of the 6 months, there will be some follow-up surveys. The follow-up surveys will include the same surveys that were asked before the training method started, so that we can see if there was a difference. We'll also ask for you to fill out similar surveys 1 year after the study starts, or 6 months after that first follow-up survey. At the 6-month time point, we'll also ask a small group of participants if they're willing to complete a brief interview with us over Zoom so that we can hear what you thought of the program. These interviews shouldn't take more than 30 to 45 minutes. The purpose of the interview is to learn more about barriers and facilitators to learning the FMF Connect Pro program and the different training formats. We'll ask you to turn on your video during the interview to confirm your identity, and interviews will be recorded. With regards to communication with the study team, we'll mostly communicate with you by phone or email. Email communications between you and the study team may be filed in your research record, just so we can keep track of things. We'll limit our messages to sending you information on research surveys, scheduling interviews if you're selected, payment confirmation, and clarifying questions to process study information. It's also important for you to understand the risks of being involved in the study. You may be bored or feel uncomfortable participating in the study. You can choose to skip any questions you don't want to answer or not talk in group sessions if you're selected for the ECHO training format. There is also a risk of loss of confidentiality. We have multiple protections in place to reduce this risk. Your identifying information is kept separate from other data you provide. All data is stored in secure online servers at the University of Rochester and locked in file cabinets within locked offices. Only project staff have access to any of this information. We also use state-of-the-art encryption to protect web and mobile applications. If you're in the ECHO training format, it's possible people may say things about you to other people who are not in the discussion, but we'll ask everyone not to do this as we get started in those groups. You may be withdrawn from the study if we suspect that you might be falsely representing yourself as a mental health care provider. If there's any inappropriate behavior or contact with the study team, those are also reasons we might withdraw you from the study. If we let you know that you've been withdrawn from the study and you think that that's for the wrong reasons, you're welcome to let us know so that we can verify your identity. A description of the study is available on this website listed here, clinicaltrials.gov, as required by the law. The website won't identify any information about you, and you can search information about the study at any time here. There's no guarantee that you'll benefit personally from being in the research study. However, we hope that the training that you are involved in is helpful for your practice and the clients you serve. It's important for you to know that your participation in this study is completely voluntary. You can withdraw at any time for whatever reason. There's no penalty or losses of benefits with withdrawal. Also, being a part of the study is not a part of your university duties if you work for any university affiliated with this program. Refusing won't affect your job, but you'll also not receive any extra job-related consideration or compensation for taking part in the research. This study has been funded by the National Institute on Alcohol Abuse and Alcoholism. For being eligible and being involved in the study, you may have the opportunity to get some payments. You'll be paid at a couple of the time points you can see on the screen. For completing the first study survey, you'll receive a $50 gift card. For completing the surveys at the 6-month time point after the training methods, you'll also receive a $50 gift card. If you complete the shorter surveys at the 1-year time point, you'll receive a $20 gift card. And if you're chosen for and complete the interview, you'll receive a $25 gift card. Payments will be given through a participant payments account. In order to pay you, we have to set up an account for you. This means that we may need your name, email, and date of birth so that we can create a profile for you. From there, you can choose to receive a reloadable debit card, direct deposit, or a mailed paper check. If you take part in multiple studies through the University of Rochester, payments are taxable. The University of Rochester makes every effort to keep your information private. Your name and other identifying information will not be released to the public about this study. We'll keep information, survey responses, and interview recordings on our secure computer servers. We'll also delete any recordings after we transcribe them. We'll use the answers you provide in the online surveys, the study interview, and responses in the FMF Connect Pro dashboard. But we won't access any of your medical records or any other information that you don't give us as a part of the study. We'll keep the information about you indefinitely so that we can continue to understand and learn from the data you provide us. If you cancel your permission, we'll remove it from the study. Results of the research will also be presented at meetings or in publications, but your name or voice will not be used. Once you provide us with information, we'll then go through a process of removing any identifiable information, such as your name, birth date, phone number, or address. We'll then assign you a globally unique identification. That just means that we can connect your information with other information you provide us without using your sensitive identifiable information. After we do this, data from the study will also be submitted to 2 larger databases, the National Institute on Alcohol Abuse and Alcoholism database, and the Collaborative Initiative on Fetal Alcohol Spectrum Disorders. Sharing your de-identified data helps researchers learn new and important things about FASD and increasing access to care more quickly than before. You may decide now or later if you don't want your study data to be added to these databases. You can still participate in the research study even if you don't want your data to be in these larger databases. Please make sure to let our research staff know right away. Once your data is included in the database, study researchers cannot take back that data. We've also gotten a certificate of confidentiality from the Department of Health and Human Services, DHHS. With the certificate, that means investigators can't be forced to disclose any information, documents, or samples that identify you in any federal, state, local, civil, criminal, administrative, legislative, other proceedings, or be used as evidence. However, disclosure will be necessary if requested through the DHHS for auditing or evaluation purposes. This certificate does not change any limits of confidentiality, though, as it doesn't prevent any reporting of child abuse, neglect, serious harm to yourself or others. If you have any questions, I've included some information here. Questions about research can be directed to the number on the screen, and questions about your rights as a research subject or any complaints about the study or other questions in general can be directed to the University of Rochester Research Subjects Review Board. Information is on the screen here. We've gone through a lot of information here in this video, so know that you can download all of the information in a handy document so that you can keep track of what you should know. Now you'll answer a few questions about what you just learned from me to make sure that you understood everything. After that, you'll fill out a couple brief surveys so that we can make sure you're a good fit for our study, and then we'll be in touch. Thanks again for being willing to learn more about FASD informed care. We can't wait to get you started on your journey. Thanks.